Thank you for joining at a 10 a.m. training. My name is Summer El-Zawawi from DuPage Federation on Human Services Reform. I direct the Public Benefit Access Program, provide training, technical assistance on any topic related to public benefits. And today's topic specifically, we will be talking about Social Security benefits. The exact application will be not going through step by step. However, we're talking about eligibility, wire-defined resources, troubleshooting issues, and a specific model, and the difference between different types of Social Security benefit programs. Before we start, I just wanted to remind everyone of our main website page, DuPage Federation. We do have trainings, public benefit and language access resources that are provided in different languages. We have trainings that have been recorded on our website, translated resources, recorded webinars, and online self-paced trainings. For public benefits, currently we have 5 on public, one of them on public benefit access for non-citizens. We have SNAP Basics, Medicaid Basics, TANF Basics, and a training specifically for those who work with children. So an early childhood provider training specifically for public benefits. Before I start, I just wanted to remind everyone that I do not have any legal background, so I cannot provide any legal advice. The information that is provided in this webinar or presentation is not intended as legal advice. It's intended as information. So if you have any case-specific questions, I would recommend reaching out to a lawyer specifically or to a specialist. Before we start again, because of how many acronyms you will be hearing throughout this presentation, if you're not familiar with Social Security Administration acronyms, this is a very good glossary just to go back to after the training if you just want to review it. So SSA, Social Security Administration, SSI will be actual Supplemental Security Income. I'll have to fix that. SSDI, we have Social Security Disability Insurance, RSDI, Retirement Survivors and Disability Insurance, SGA, Substantial Gainful Activity, which is working in some cases, CDR, Continuing Disability Review, and IRWA, Impairment-Related Work Expenses. I will try my best to spell them out during this presentation. However, this is just a very quick overview of some of the acronyms that you might be hearing today. Okay. Other terms, if you have attended any of our previous trainings, we do a lot of trainings on IDHS benefits, Illinois Department of Human Services, HFS, Illinois Department of Healthcare and Family Services, TANF, which is the Temporary Assistance for Needy Families, SNAP, Supplemental Nutrition Assistance Program, and AABD, Aid to Aged, Blind, and Disabled. So today we'll be talking about specifically about Social Security Administration in general, about their benefits that are available, non-citizens eligibility for benefits, meaning Social Security benefits specifically, the difference between SSI and SSDI and who is eligible to apply for which, and when you can apply for both of them, work ticket and SGA, which is being working, bringing in money, when would you still be eligible for benefits? When would you be cut out? SOAR, which is a specific model we'll talk about, and resources where you can learn a little bit more about Social Security Administration benefits. In general, Social Security Administration, this is their website. Why did I provide a picture of their website? Because I found that this is the best way just to explain that they do have a website. Can you apply through their website? The best way to apply for Social Security Administration is actually still a paper application. You can go to any of the local offices to apply, make an appointment online through a phone call. However, there are many other ways we'll talk about later during this presentation. What are the purposes of Social Security in general? So, the Social Security Act and any related laws can establish a number of programs that do have following basic purposes. They follow for any material needs of individuals and families. So, the need of it just to like some type of insurance for these types of for the families in general, to protect them and specifically those who are aged and disabled individuals against the expenses of illnesses that can otherwise use up their savings, and also to help and keep families together and give the children the chance to grow up. What type of programs that are included that would be considered Social Security? We have retirement insurance, survivor insurance, disability insurance. We have hospital and medical insurance for the aged, disabled, and those with end-stage renal disease. I mentioned this specifically. Some states do not have Medicaid expansion. So to be eligible for Medicaid in those specific states, you have to be eligible for Social Security Administration benefits. Thankfully, in Illinois, we still have Medicaid expansion, so this is not a requirement to receive Medicaid. Prescription drug benefit, extra help with Medicare prescription drug costs, and supplemental security income, special veteran benefits as well. We also have unemployment insurance, public assistance and welfare services, which are basically federal benefits that we know that are administered through the Illinois Department of Human Services, such as TANF, some types of Medicaid, and food stamps, energy assistance, and so on. We're mentioning these here because they are considered federal funds. Um, why did I want to talk about immigration status? Because I know many of you who are joining here today are caseworkers that work with different with clients that are from different types of immigration status. Um, I'm sure if you have attended many of my previous trainings, we do talk a lot about extensively about the difference between qualified and non-qualified non-citizens, especially when it comes to eligibility for benefits that is administered through the Illinois Department of Human Services, such as food stamps, cash benefits, and Medicare and healthcare specifically. The same thing when it comes to Social Security benefits, it is a federal benefit. So you have to be a qualified non-citizen when it comes to receiving these type of benefits. Non-citizen can be eligible for SSA benefits if they are considered a qualified non-citizen. Um, and they have to meet a condition that allows qualified non-citizens to get SSI specifically. This specific sentence, what is meant by it is they have to still meet income thresholds. They have to meet a situation like if they're disabled, they have to be disabled as it is defined by Social Security Administration and so on. So who is considered a qualified non-citizen? Anyone who has a green card or a lawful permanent resident for 5 years or longer. Those who have that for less than 5 years would not be eligible for Social Security benefits, which in this case would be the Supplemental Security Income. Non-citizens with humanitarian or other special statuses, such as refugees and asylees, Cuban Haitian entrants, certain abused immigrants, survivors of trafficking, active duty, military or veterans, their spouses, and many more, which could include Afghan humanitarian parolees, Ukrainian humanitarian parolees, and other special cases. Non-citizens that are not qualified for Social Security Administration benefits would include those who are undocumented. Undocumented individuals are also would include also those who have already filed for asylum. However, they have not received their asylum status yet, so they're still considered undocumented, therefore not qualified for this benefit. Lawful permanent residents, LPRs, living in the United States for less than 5 years, and anyone who has a temporary status, such as students, tourists, and so on. For non-citizens that are receiving Social Security Administration benefits, there is something we do call a 7-year time limit, or a 7-year time limit. It's the best way to simplify it. So qualified non-citizens that are receiving Social Security benefits would receive it up to 7 years, specifically when it comes to supplemental security income. The benefit would be cut if the non-citizen does not become a U.S. citizen within those 7 years. Um, so normally what happens, the client in general, or you yourself, whoever is receiving the benefit, would be receiving a letter from Social Security Administration telling them or telling you that uh, informing you in general when your 7-year period ends. They'll send another letter explaining your rights to a plea before they stop your payments. And if you're current or former SSI recipient subject to any of these in general, if you have already applied for citizenship, please do report that. Um, because the reason why they're cutting this 7 years, because during these 7 years, they're expecting whoever is a qualified non-citizen, meaning they're here legally, they're supposed to be applying for citizenship during that time. Let's say for green card holders, normally after you have a green card for 5 years, you're eligible to apply for citizenship. This is one of the examples I can think of. So to make sure that you or your client is still receiving some benefits, they have to submit some type of proof that they have submitted their citizenship application, or that they are any type of other proof that, let's say, for example, that they are working towards citizenship, or provide another proof why you have not um, applied for citizenship. Oops, sorry. Okay, just gonna look quickly if there's any questions about immigration status before we move on. I don't see anything. Great. So moving on to the next section, which is Social Security. In general, when we go for cash benefits, so we do have two cash benefits that we know of. Social Security Insurance, RSDI, which are for your retirement survivors disability insurance, and Supplemental Security Income, which is also known as SSI. Um, so Social Security in general is designed like any type of insurance system. You have to be paying into the system, specifically when it comes to Social Security insurance, through your taxes. So when you do, if you're working, your pay stub, the section that says Social Security, this is exactly what they mean by it. So it's like a type of insurance just in case if you get disabled in the future, or over the age of 65, for example, you can apply and receive this specific benefit. A lot of people do confuse these two different benefits with each other, which is RSDI or SSDI and Supplemental Security Income. So Supplemental Security Income in general, you do not have to be paying into the system to receive this. It's only according to eligibility. However, again, for SDI or SSDI, also you have to been paying into the system through taxes for a certain amount of time. Qualifiers for Social Security Insurance, RSDI. Again, you have to have sufficient Social Security earning credits through paying into FICA, um, through pay stubs and so on. You have to be a U.S. citizen or any of the qualified immigrant statuses that we just mentioned. Meet age criteria, which is over the age of 65 for seniors, for retirement, or have a surviving dependent or spouse of wage earning survivor. Meaning this specific sentence means let's say you have a client that has a family member that has been working for many years and paying into the system. They have passed away. They have children under the age of 19, dependents. Those children under the age of 19 dependents could be eligible to receive their parents' RSDI. Or you can be disabled and unable to do any type of work. You have to be defined disabled by Social Security Administration. There is a whole process by submitting proof through doctor notes, witnesses, and so on. And if Social Security Administration has determined that you are disabled, you would be eligible for this type of benefit. And again, you have to have already been paying into the system for a certain amount of time. Again, about FICA taxes and Social Security insurance, an example of a payroll check stub. Some of these taxes that you would see on your pay stub would include federal withholding, for example. This is the part where we were talking about Social Security. We have Medicaid, state disability insurance as well, and state withholding. So this is just explaining where all of your taxes are going to, which is one of them, Social Security. You have to be paying at least 10 years to be eligible for this type of benefit. Disability or survivor benefits, retirement disability or survivor benefits from Social Security in general. But the 10-year is not it's for the majority. However, there are certain cases you could be paying into the system much less and still be eligible to receive this benefit. More detail about supplemental security income and Social Security disability income. So these two different programs are administered through and ran by Social Security Administration. It is specifically for those who are disabled and unable to work. SSDI is specifically an insurance program. It provides monthly income to workers who become disabled and to certain family members, as we've just mentioned. Supplemental Security Insurance, SSI, it provides monthly income for people who have not been, you do not have to be paying into the system. However, you have to be considered eligible due to certain situations, such as being over the age of 65, being blind, disabled, and you have to have very limited income and assets. Just a very, hopefully the image is clear on your side. So the difference between those two specific programs, if we go to SSI, eligibility is based on need. You have to be low income and resources and living arrangements. So how much you have to be making for a single individual that is applying for SSI, it's $2,000 per month. For a couple, it is $3,000 per month. So the month compared with Social Security disability insurance, eligibility is based on insured status. FICA payments, as we've mentioned, you have been paying into the system for a very long time. Back to SSI, the monthly amount is based on the federal benefit rate. So every year, the amount of money that you could be receiving, so there's a maximum amount, of course, which is $967 per month. Compared with SSDI, monthly amount is based on earnings history, how much you have been paying, because it's depends on, again, your FICA payments, how much money you have been paying, and so on. So there is no exact amount of money or that you could be expecting. It depends on your work history again. The date of eligibility for SSI is based on protective filing date and application date. That's the great thing about it, because a lot of times these types of applications, specifically SSI, could take very long times, a very long time. It could take months. It could take over a year just to hear of a decision. So the good thing is that you would be receiving retroactively the, let's say if you are eligible for $967 a month for the whole year up to the like starting from the date when you had the application. Just to clarify it a little bit more, let's say you apply for SSI on January 1st of 2025. You get an approval on let's say in December of this year. So you would be receiving retroactively benefits for 12 months before, all in one check. For SSDI, date of eligibility is based on the date of onset of disability, meaning when you were disabled. The date you were disabled would be the date of when you would be eligible for this benefit. This could be when you were diagnosed with your disability through a doctor, and there are many other ways to prove that as well. Going back to SSI, the type of health insurance that could come with this type of benefit is Medicaid. So again, some states do not have Medicaid expansion, and one of the ways that you would be eligible for Medicaid is being eligible for SSI. Back to SSDI, the type of health insurance that is associated with it is Medicare. And we'll go into a little bit deeper into each type of benefit, starting with supplemental security income. So SSI provides monthly payments to those who have disabilities and older adults who have little to no income or resources. Adults and children can be eligible for this benefit if they have little to no income, little or no resources, and disability blindness, or they are over the age of 65. So for this year, SSI 2025, how much you could receive because every year it's a little bit different. You might be receiving up to $967 per month. For last year for 2024, it was $943 per month. For a couple, if let's say a married couple is applying for this benefit together, they could be receiving up to $1,450 a month. Um, Last year it was up to $1,415 a month. Resource limit means how much income you're eligible, how much income you can be making, or resources that you do have, um, and you could still be eligible for benefits. An individual can make up to $2,000 and still be eligible. A couple can make up to $3,000 and still be eligible. If I know it's very low, this is even like before any taxes are taken into consideration. For payments, how can you, if you want to calculate your own SSI payments or just a quick estimation how much you could be receiving per month? So for every $2 you are earning for work, SSI payments will be reduced by about $1. Let's say you make $100 a month. So you could be reduced around, your benefit can be reduced up to $50. In this specific case. So work could include a job. You could be also self-employed, any activity that earns you money. For every dollar you get from a non-work source, they would be reducing your SSI payment by around $1. Non-work sources could include such as disability benefits, unemployment payments, pensions. Um, and if you are living or your client is living with a spouse, if they're married or has a partner, their income can also affect their payments. Children who are on SSI who live with their parents might have their payments lowered based on their income of their parent or their parents' income. So children who have SSI, if their parents are working, their eligibility for SSI would be depending on their parents' income. Moving to Social Security disability income to be eligible for this specific benefit or to be eligible for, disability, you have to have a disability or blindness, and your disability has to be defined by Social Security Administration. On Social Security, Securities Administration's website, SSA, they do have a list of what they could be considered as a disability. Um, and when you are applying for benefits, your application has to go through DDS, and DDS would be determining your disability and reporting it back to SSA. Um, Other than having disability or blindness, you have to have enough work history. So your client or you must have a disability that affects your ability to work for 1 year or more, or will result in death, meaning the disability that your client has been diagnosed with that prevents them from working has to be lasting for at least a year. Or let's say they have a certain illness or certain situation that does not allow them to work for the rest of their life, that would be also eligible for this type of benefit. If you continue to work, your condition must also limit you from earning income above an amount that I call substantial gainful activity, SGA. So in 2025, this year, SGA is at $1,620 per month, or $2,700 if you are blind. You have to also have been working for at least 5 of the last 10 years to qualify for disability. So they would be looking at the last 10 years that you have been working. You have to been working or be part of substantial gainful activity for 5 of those years to be eligible for this disability. And again, the amount of money depends on how much you have been paying into the system. People who are under the age of 24 may not need to have worked that long. And here it is. So this specific Table I have here explains a little bit more about how long you need to be working to be eligible for SSDI benefits. So in general, earnings to qualify for credits. This is so for example here in $1,810 per 1 quarter of coverage, you could be eligible for credit, and there's a specific maximum amount. For disability specifically, if you do become disabled before the age of 25, you have to been having working for at least a year and a half, which is considered 6 credits, as of 6 quarters in the 3 years before you became disabled, which is shorter than the 5 years to 10 years. If you are between the age of 24 through 30, you generally need credits for half of the time between the age of 21 and the time you have became disabled. If you are disabled at the age of 31 or older, you generally need at least 20 credits in the last 10 years, which is in the amount of 5 years immediately before you became disabled. Um, so again, just a reminder of how much money you could be receiving from SSI, which is up to $967. Why did I mention it again during SSDI is because those who qualify for SSDI could also qualify for SSI, if they meet income threshold. So when it comes to the application itself, SSI and SSDI applications are two different applications. If you have a client, for example, that is very low income and has been working for a certain amount of time, as we've just mentioned, over the age of 31, let's say they've been working for 5 years out of the last 10 years, between the age of 24 to 30, you have to have at least half the time. Let's say you became disabled at 30, so you've been working 6 years, you had 6 years between 24 and 30, so you had to have been working at least 3 years of those 6 years. So if you have been doing that, you could, and you're very low income, you could be eligible for both SSDI and SSI, and also under the age of 24 and you're disabled and low income, you could be eligible for both of these benefits again together. I can receive a couple of questions before I go to work incentives. Um, Sorry. Which of these, if any, would children with disability qualify for? Um, Children for disability could qualify for SSI actually, and it depends. So supplemental security income. I'm so sorry, I keep saying social security income. Supplemental security income SSI. It depends on need. So children's eligibility would depend on their parents' income. Um, so if a child is disabled and they have been determined disabled by Social Security Administration, they could be receiving SSI up to how much was the amount again? $967. SSDI would be depending. The only case I can think of SSDI is if the parent passed away and has been um, paying into the system for the amount of years that will be mentioned, their dependents under the age of 19 could be receiving their SSDI benefits. If both a husband and wife qualify for SSI based on disability, the most they can receive is, yes, the most they can receive under SSI is $1,450 for this year. Every year it's a little bit different. So last year it was $1,415. The reduction based on earned income. Oh, if you mean by the $2 by for every hour, for every dollar earned, yes. So any type of SGA that you go through, substantial gainful activity, meaning work, a job, self-employment, you would uh, every $2 you'll be making, a dollar will be taking off. However, if you have money from other resources such as unemployment and so on, for every dollar you are getting from unemployment, a dollar will be taken off of your benefit. How young can a child be to qualify for SSI? Um, I don't think there is an Um, Children under the age of 18 can still qualify for SSI. There would be more requirements, such as the parent's income. There will be questions about the parent's income, such as the parents have to be making less than the thresholds that we've mentioned earlier, and they have to be disabled by um, uh, determined disabled by DD as an SSA. The application for a child is very extensive. It is very hard. I am going to talk about a specific model at the end of the presentation that could help with the possibility, like if you do use it, it could help receive benefits faster. However, children under the age of 18 can still qualify for SSI. The parents can apply for them. There shouldn't be an issue. A senior born in the year of 1960 in January, he is eligible for SSI, but not for retirement benefit as eligibility is 67. The retirement benefit that you are mentioning is something different. SSDI, 1960, how old would be 1960? Sorry. Would it be 60? How old would be 1960 currently? Okay. Sorry. I'm trying to go back to the question. Yes. So SSI, Supplemental Security Income, if the senior is over the age of 65 and they're low income, they will be eligible, and the application for it is much easier because disability eligibility determination of disability is not required. Um, so SSDI, actually I'm not 100% sure. I'll make sure of it and get back to you, Benny. Sorry. Is the $2,000 per person in income per month or per year? Per month. They have to be making less than $2,000 per month. Are there any organizations that help families apply for SSI for a child? For if you are here and you do help with that, please do add your information here. Some organizations that do help with benefits in general help with SSI. However, I would be talking at the end of this presentation about a specific training that you can go through that would qualify you and give you the resources to help you apply for your client without an assistant of an outside organization as well. If someone is working during the time when their disability benefits are pending, does that impact their ability to receive Social Security disability? I have someone who's working full-time with MS. However, it is incredibly difficult for him to do so. He likely should not be. It depends on how much he is making. We will be talking about how much the limit they can be make and still be eligible for Social Security disability. Which of these, if any, would children with disability qualify for? Um, and yes, they would be eligible for SSDI depending on how much their parents have been paying to the system, but they also would be eligible for SSI if they are low income. So Rebecca is mentioning, so everyone knows if you have not been reading the chat, Word Relief can help refugees and immigrants who are or are eligible to apply for SSI. Another question they have is it true that people on disability are spied upon to see if they are doing things that their disability should restrict them from doing? I have no idea. I am so sorry. That is interesting. Um, I don't know, and I don't think it's going to be mentioned anywhere. Sorry about that. Martha, doesn't the 2000 limit effectively eliminate the 967 you would get from SSI? So when they do determine eligibility, they would look also into like any expenses that you do have in general as well. So I would recommend just apply if they're making it less than $2,000 anyway. So if there's any more questions, I will be answering them later during the presentation. And let's move on to work incentives. So work incentives, specifically meaning that you can work and still receive Social Security benefits such as SSDI or SSI, meaning that you can still work, keep your benefits, and still make some type of money. However, you cannot be making more than a certain amount. If you do, unfortunately, your benefits would be cut. So in general, the Social Security programs and rules allow people to keep their benefits, which we call work incentives. There are a number of different work incentives and programs that those who are receiving benefits can participate in and still have their benefits. One of the reasons of these work incentives is that if a disabled person wants to go back to work, this would help them and still keep their benefit. The idea is that these programs would help you keep your benefits and explore work. And it actually allows you to make more money. And gain new skills. So specific programs are programs throughout the state of Illinois that help disabled individuals to get a skill and start working and still keep their benefits. So what is SGA? SGA is substantial gainful activity, and to be eligible for disability benefits, a person is not able to engage in SGA. Income earned has to be below the SGA threshold, and for those who are not blind, they have to be making less than $1,620 a month. And for blind individuals, they have to be making less than $2,700 a month, and for them to still be receiving their benefits. One of the myths that we have been hearing specifically about Social Security income and disability is that people cannot earn more than a certain amount of money if they want to keep their benefits. We will be talking a little about more about how you can keep working through work incentives and what would can be discounted to reduce your accountable income. So when it comes to SGA or substantial gainful activity, this is what specifically the money you earn through work activity as either as an employee or a self-employed person. There is a very detailed guideline by Social Security Administration about when people do first apply. It provides information about what's considered SGA. So applicants would know in detail how much money they can be making and still be eligible. So the ticket for work, specifically for those who are between the age of 18 and 64 who receive SSDI or SSI, they provide services to help you find and keep work. How can you participate in these specific programs? You can do that by contacting the Employment Network or any of the resources they have on their website. You can also call the ticket call center at this specific number, and access to employment support services for Social Security, disability beneficiaries who want to work. There is a specific website you can go to, which is choosework.ssa.gov, that you can go through and receive some type of employment as well. This type of program is free and voluntary. And does not mean if you're receiving benefits through Social Security Administration that you do have to participate in this specific program. It helps people who have disability move forward, financial independence, and connects them with the services and support they need to succeed in the workplace. It is specifically a good fit for those who, again, who are receiving SSDI, but who want to improve their earning potential and are committed to preparing for long-term success in the workplace. It can also offer qualified individuals with disability access to meaningful employment with assistance of authorized employment service providers that are in this specific link. So what should you do if you are receiving SSI or SSDI and you want to go back to work? Please do report your changes as soon as you can to Social Security Administration. When specifically, anytime you start or stop any type of work that that you have reported previously, you have already reported work, but your duties, hours, or pay have been changed. You can report that as well, meaning you could be earning more or less money. You start paying for expenses that you need for work due to disability. Why? Because they could deduct that when they are determining your eligibility. So trial work period specifically for 2025 for those who have for those who are on SSDI, it allows you to work for 9 calendar months. And it does not have to be continuous 9 months. It could be like all over the place. For example, a couple of months, then you stop working, then you start working again. During that time, work will not be used to see if disability has ended. Continues until 9 months of services within a rolling of 5-year period. Work counts if you make more than $1,160 per month if you are working as part of the trial work period, or more than 80 self-employed hours in a month, regardless of how much money you're making as a self-employed individual. So what happens after these 9 months? After you have been working 9 months, your eligibility has not been taken, like uh, to see if you're eligible, they have not been screening you again. What happens after those 9 months of working? So there's an extended period of eligibility, EPE. So EPE is a consecutive period of 36 months after the last month of the trial work period. So after you finish those 9 months, those 36 months would start. The first month above SGA, so if you are making more than substantial gainful activity for that specific year, um, disability ceases. Benefits are paid for that month and the following two. However, after that, if you're making the amount of money you're making is still over SGA, your benefits will be cut. However, if they go down SGA after those 2 months, your benefits can continue. So anytime during those 36 months, anytime your SGA substantial gainful activity goes under the threshold, um, your eligibility could go back. So it allows you to start getting SSDI payments again if your earnings fall below SGA. It's during those 36 months and does not apply SSI payments. It's only for SSDI. How is work continued as SGA? Um, And SGA determination in general is a process that focuses on a person's earning and their work activity. The gross earnings are only the starting point when making an SGA determination. They also look at on impairment related work expenses, subsidies, special conditions, vacation, sick payment, and any earnings not directly related to your work activity. So impairment-related work expenses, or also now known as IRWA, is the cost of certain disability-related items and services that you need so you can work. It could work in two different ways. By deducting from your earnings or your pay, you get to figure SGA for SSDI, and does not count as income to figure SSI amount. So what are the requirements for this specifically? The person with disability must pay for the items and services. It could include service dogs, for example. It could include anything that assists the disabled individuals to walk, any medical equipment, and so on. Items or services must be disability related. Cost has to be reasonable, meaning you cannot report that you've paid $2,000 for a walker. It could be costing up to $200 instead of $2,000. And these are some examples. We have attendant care services, service animals, medical devices, wheelchairs, etc. And again, about medical devices, you cannot report, for example, if you need a wheelchair, you cannot purchase a $5,000 wheelchair and there's a $500 wheelchair that works perfectly for you just so that you can report that. Regularly prescribe medical treatment or therapy necessary to control the disabling condition, which also could include physical therapy, and many more. Anything that could help relieve pain, anything that could help with the disability the individual is going through. Subsidy, subsidy and special conditions. So the employer pays more than reasonable value of an actual work done. A third-party job coach paid by vocational rehabilitation agency. So an employer can subsidize an employee with a disability by paying more in wages than reasonable value of actual services performed when they are reporting. Special conditions are generally provided by someone other than an employer. For example, again, a third-party job coach or a trainer or anyone who works in a similar job as well. How can you report work to SGA substantial gainful activity? When you do report that report, when you have started that specific job, for example, the employer name, who is your boss, basically, or like what's the entity you're working for, work schedule, wage and monthly income, information on impairment-related work expenses, if employer provides extra help. All of that information is important when you are reporting SGA. Copies of pay stubs and proof of IRWE or subsidy expenses are required. And please do keep any receipts that you do receive from this. If you are receiving SSI, benefits will stop if you earn over the SSI limit immediately. It's not like SSDI. The moment you're making more than the SSI limit, which is $2,000 or $3,000 for a couple, your benefit for SSI will stop immediately. So when do benefits stop? When it comes to SSDI, as we've mentioned, you can be part of substantial gainful activity working for 9 months. Then you would be part of EPE, which is the 36-month that we've mentioned through. Anytime you go over SGA, your benefits would stop. And the moment it goes under, your benefits will go back during those 36 months. For SSI, the moment your earnings are 3 times more than SSI benefit amount, your benefits would stop. So it depends on how much you'll be making from SSI. The moment your earnings are 3 times the amount of that, it would be cut. This is an example over here. If you earn, let's say, around $1,000, the 85 in this example, 915 divided by 2 is $457. So your new SSI check is this amount, and the total income is this amount. Meaning in this specific example, if we're looking into, let's say you're making, you have earned $1,000. And $85 were taken into consideration when it came, let's say, associated with the disability and so on. So your actual income is $915. And so you do divide it for 2 when you're looking into how much SSI you're supposed to be receiving. Your new SSI check, let's say, is $277, and your total income then will be $1,277. So if you do get cut off and your benefits, let's say for any example, gets this like cut off for any example, the moment you go, let's say, over SGA, for up to 5 years after benefits end because of work and earnings, you can request benefits start again without having to complete a new application, which is great because a new application takes a very long time. You can get temporary benefits for up to 6 months while SSA decides if you can get benefits again. You can ask for Medicare and Medicaid while you get temporary benefits. This is specifically for states that do not have Medicaid expansion. Health coverage, because earlier we did mention that receiving SSI and SSDI, you can receive some type of health coverage during if you do receive any types of those benefits. So if you are receiving Medicare coverage due to receiving SSDI, it could continue for at least 93 months after the trial work period. After the 93 months, individual under the age of 65 is eligible to purchase Medicaid coverage. However, Part A is no longer premium fee, so they have to pay for the premium to receive Medicare. Those are only for those under the age of 65. Um, Continuing disability review. So the law requires a continuing disability review approximately every 3 years or sooner. So they would be seeing if the individual is disabled or not. So we do have two types of review that are done, medical and work. There is also called something a triggered review. It often occurs when you do return to work to see if you're gaining in any type of SGA things, SGA, and you're making enough money, for example. A medical continuing disability review is based on work activity is not done if you have received disability benefits for at least 24 months, meaning um, your disability has been going for a very long time and you have been receiving for a long time the benefit and have been participating in the Ticket to Work program. SSI when an CDR, sorry, is done, review of income resources and living arrangement is also done at the same time. Okay. True or false? So I'm just going to ask a couple of questions. If you want to participate, you can use the chat just to answer. If you work, your SSI and SSDI application will be automatically de denied, meaning the moment you start working, will your application be denied automatically or not? It is false. Um, okay, moving on to the next one. Benefit and health insurance end as soon as you start working. So the moment you start working, your benefits would be cut. Okay, false. Great. You can only work part-time while receiving a disability. Is that true? Is there a requirement that you have to work only part-time? No. Um, the last one, if Social Security knows you are working, they will say you aren't disabled. Is that true or false? Okay, great. So as everyone mentioned, all of these statements are false. These are very common myths that people have a very uh um the people have a lot of misunderstandings about, like the moment you do work or you are making any type of money, your benefits would be cut off. Fortunately, these statements are false. However, it is important to plan and coordinate with Social Security so that your benefits are protected. So anytime you have a change, please do make sure that you are reporting that change. How can you apply for Social Security Administration benefits? Again, the best way currently is still a paper application. You can use the website to learn a little bit more about what type of benefit you'll be eligible for, and you can also assess your eligibility through the website. It has a screening method that you can answer to see if you're eligible for retirement, family disability, or survivor benefit, or any type of the supplemental security income for disability or those for over the age of 65, for example. So this is the model I did mention earlier that I wanted to talk about, but before we go through there, I think I did have a couple of questions earlier, so I just wanted to see if I can address before moving on. Sorry. Okay, we have Kristen mentioning also at the Refugee Center in Champaign. They've been assisting refugees with applying for SSI and SSA in both Champaign and Bloomington. The main issue is that staff at house as SSA allocations weren't aware refugees are eligible and denied their eligibility to apply. Um, yes, interesting. I did hear of the same issue of other providers as well. However, the website, SSA website does mention about non-citizens who are eligible. So if your client is a refugee, they should be eligible according to immigration status for SSI. So what I would suggest if you do get a denial, just appeal. Um, and if you're able, because most likely when you do an application, an SSA application, SSI application, your case would be assigned to a caseworker there. So if there's a way to communicate with a caseworker, that would also be great. However, Oh, she did mention what they have been doing. They ended having to go through SSA at the state level and then work directly with managers of each branch after they spoke to their state supervisor. It's mostly gotten ironed out, but we are stuck on a couple of cases for reasons that feel very dumb. One case, for example, still own a home in their home county, and SSA is demanding a professional appraisal. Oh, interesting. Yeah, I did hear in general there have been a lot of situations where something like this happens, especially when it comes to immigration status, that, oh, they're not non-citizens, then they would not be eligible for benefits. However, they are. This is a model that I would be mentioning about how to work with, how to have connections with SSA DDS and working with a local or a state lead for SOAR and make sure that your applications are going through, which I'm going to talk about right now and how to go through that training as well. Why are blind around sorry sorry. Why are blind allowed more than non-blind in SGA? Good question. There is no reason specifically written, but if I just have to guess, and maybe it could, I'm not sure, I'll have to look it up, but it could be maybe due to maybe they need more expenses in general because of their disability. Um, but I can ask and let you know. Anita, thank you for asking that question. What if a disabled person cannot drive? Would they be able to receive transportation expenses? Um, through Social Security Administration. Ho- So through Social Security Administration, I don't know of any transportation expenses. However, there are a lot of programs within the state of Illinois that do assist with transportation for those who are disabled. So let's say a disabled individual that is receiving SSI or SSDI, and this in these cases specifically, they would be eligible for Medicaid and Medicare. Medicaid and Medicare would can pay for transportation to medical appointments specifically. So that's a way the client could be getting some type of reimbursement for transportation expenses. Other than that, I am not aware. Are AAC devices for communication considered medical devices? I am assuming any type of device that helps with the disability for your client is considered a medical device. If a person moves to Puerto Rico, will it lose SSI benefits? Very good question. Puerto Rico. So Puerto Rico is supposed to be a U.S. territory, so I do believe U.S. territories are still eligible for SSI. The good thing about SSI and SSDI benefits are not related to state, they're federal, so wherever you move within the United States, you're still eligible. So I do not think it will be affect their benefits. I'll make sure and get back to you, Rebecca, though. The blind will get more SSI than non-blind, correct? Is there a way to report changes to SSA for SSI? Um, without having to wait on hold on the phone or wait in the um so to re so it's supposed to you're supposed to be able to do that online, however you cannot. Other than that, unfortunately, you will have to make a call through to SSI or just go in person and provide that information to a local Social Security Administration office, unfortunately. Okay, moving on to SOAR, which I really wanted to talk about today. So, SOAR is short for SSI SSDI Outreach, Access, and Recovery. It helps states and communities end homelessness for adults with serious mental illnesses and children with serious emotional disturbances through increased access to Social Security disability benefits. What is SOAR in general? It is a model for assisting eligible individuals to apply for Social Security Administration for individuals who are experiencing or at risk of homelessness and have a serious mental illness, co-occurring substance use disorder, or other physical disabilities. So this specific model or program is sponsored by SAMHSA in collaboration with Social Security Administration and has been going on since 2005. All 50 states and Washington, D.C. currently are participating in this model. So in general, when you do apply for Social Security Administration benefits, as we've been mentioning throughout this presentation, and as we've been seeing in the chat, there are many barriers to access these benefits. A lot of people who are experiencing or at risk of homelessness specifically also have disabling mental illnesses and co-occurring substance use, trauma, and or other medical issues. And accessing SSI and SSDI could be difficult. And having these benefits can provide a very critical first step on the road to recovery. So Social Security Administration unfortunately still communicates mainly by mail, which is a challenge specifically for those who are considered homeless because they do not have like a specific address. People who are experiencing homelessness often have sporadic medical care, making it difficult to access medical records to document disability. I know we've mentioning about SOAR a lot about homelessness. However, this model is not only for homeless people. It's for everyone who could be eligible for SSI and SSDI, but this is just the background of the program itself, why it started. Symptoms specifically can interfere for those who have a disability and affect their cognitive function and make it difficult in general to navigate these complex systems. So SOAR in general helps to overcome these barriers. Caseworkers that take the web-based SOAR online course to learn how to effectively gather documentation and submit a complete and thorough SSI and SSDI application packet to SSA. States, communities, and agencies all collaborate together with stakeholders and agree on a SOAR process that supports SOAR-trained caseworkers and establishes protocols for submission and processing these applications. State and local SOAR team leaders support SOAR trained caseworkers and keep community partners engaged. And then we have the SOAR TA Center, the Technical Assistance Center, that provides the technical assistance needed to keep the SOAR effort moving forward. So, a very quick background about this program. So, we do have two online courses. We have the SOAR Online Adult Curriculum, which helps you and provides you with the information and equip you with the resources and skills on how to submit high quality Social Security disability income and supplemental security income applications. The youth one is for a child curriculum specifically, are the same thing. However, it provides you more information on how to submit these types of applications for children. These two trainings are completely free. They can take around 20 to 40 hours to complete self-paced. And if you go through this specific course with and you submit all of the homework, assignments, and everything, you can receive 20-hour CEUs for social workers. So if you are a social worker and you need CEUs to maintain your license, these are two free courses that you can get up to 40 CEUs if you go through both of them. So throughout the training, you'll see a lot of articles and content, a lot of videos. There will be a lot of support through the TA Center and a lot of practice cases. So when you do go through these courses, you have to submit around 6 or 7 assignments related to applications, and we'll give you like examples and all of that. And to receive the final certificate of completion, you have to submit a full SSA benefit application, and the TA Center will have to assess it with you. You will also learn how to write high quality reports and how to become a legal representative for your client with SSA and communicate on their behalf and so on. Again, the training itself takes 20 hours. Could take up to 40 depending on on the person and the application in general. When it comes for SSA and SSI, SSDI, it takes 20 to 40 hours to complete. So after you do finish the training, you have access to something called OATS, which is the online application tracking. This system allows you to track all of the Social Security Administration benefit applications that you have been submitting. It is web-based, user-friendly, HIPAA compliant, monitors qualities, and takes 3 to 5 minutes and is completely free as well. For supervisors that do not want to go through this course, however, they have caseworkers that could go through this course, they can have these supervisors can have also their own access to the OAT system just to manage and supervise and make sure all of the data is written in it. This is just the structure how the program works to also assist Social Security Administration benefits. So the SOAR TA Center, which is the center that provides technical assistance when it comes to Social Security Administration benefits, and they have a very good relationship with the local and statewide Social Security Administration offices. They facilitate in general strategic planning meetings with all of these people that we're mentioning about, conduct leadership academies, webinars, and learning communities. They develop resources, which includes SOAR Works, the SOAR online course, and OATS, provide TA at all stages of SOAR implementation. State team lead. So each state that has the SOAR program has a state team lead. SHIPA in the state of Illinois has a state team lead. Currently, that specific role is vacant. They're currently looking for a new person. So they normally facilitate state steering committees that has all of the local leads and case managers within that state. They direct, plan, and grow and sustain statewide activities. They serve as liaisons to localities, maintain good relationships with SSA and DDS, and submit SOAR outcomes to the TA Center. The good thing about this, because they have good relationships with SSA and DDS, they can communicate with high supervisors in these locations. So for example, if those who are submitting applications for SSI and SSDI are seeing as an issue, as we've mentioned, applications for non-citizens that are qualified, that person can communicate that to those people, and hopefully they would be able to assist, for example. But you have to so local leads. So each let's say some counties or some areas have local leads. So currently I am the local lead specifically for DuPage County. So if your organization is in DuPage County and you're interested to go through this training, please reach out to me and I can assist you to start. Or if you have already went through this training and you want to connect, to reach out to me. So some counties, so Cook County has a number of I think 3 or 4 local leads. There are many others on the website you can find. You can find their whole information, their name, organization, and contact information, how to reach out to them, and so on. So they normally facilitate SOAR online course cohorts. So these online course cohorts, meaning they will not be providing the training. However, they would be walking through the trainings with those cohorts, following up with them until they're done with it, and provide any type of TA with partnership with the SOAR TA centers. They conduct as well SOAR online course review sessions and ensure quality application to report outcomes. Case managers, which are case managers as yourselves that are doing Social Security Administration benefit applications such as SSI and SSDI, they, due to this training, will complete high quality applications using this specific model. They have communications and have resources with SSA and DDS local representatives, and they will be able to track application outcomes online very easily. So just to show you how successful this specific model when it comes to Social Security Administration benefit, SSI and SSDI, some states have around over 79% of an approval rate when using this model for SSI and SSDI applications. Some of these states include Tennessee, Pennsylvania, Maryland, Arkansas, North Carolina, Virginia, Oklahoma, South Carolina, Oregon, and Nevada. Some states actually have over 90%, and I think Virginia's are over 90%. Some states, their SOAR model is well known that they even have their they like created their own certification process, and in general this specific model is very known even within the SSA offices, the state offices, and they are actually highly willing to participate and communicate with caseworkers that are SOAR trained to complete applications. For last year, 2024 outcomes, for example, initial applications, the approval rate was 65% from the first time submitting an application using this specific model. And throughout the whole years since they started this model, I think from 2005, those who submitted applications using this model, 65% was the initial approval rate. And then 49% of those received an approval after the appeal process. So this is specifically for Illinois, how it is going right now. So SOAR in Illinois needs a little bit working because not a lot of people are doing SOAR. A lot of people who are trained, however, not a lot who are actually going through it. So for 2024, specifically 43% of approval rate on initial applications. And in general, we have a 52% approval rate on initial applications from 2005 until now. For compared with traditional applications, those who are submitting it without going through the SOAR model, it was 35%, which is around a 15 to 17% difference in Illinois. Who should take this specific training? Anyone who would like to learn more about SOAR. You do not have to be a caseworker that is willing to submit Social Security Administration benefits. You can go through this course, but without submitting let's say, the tests and everything, just for information for yourself, if you want. Enrollment, again, in these courses is free. However, again, to receive the 20 CEUs, you have to go through all of the course, included the assignments and quizzes and so on. Yes, and that is actually the end here. Let me see if you have any questions before I move to resources. Yes, presentation recorder will be shared. I'll make sure the recording will be available, sorry, on our website as well. Can someone take this training just to have information? Yes, you can take this information to have it, take this training to have information. So for example, if you have a client, even clients can take this training if they just want to have information. They would not be eligible to go through the whole training to submit applications on behalf of other people because they're not affiliated with an organization. However, if they want to go through it just for information to know, um, let's say, for example, what to have ready for their application, or they want to help a family member or so on, that's fine. Or if you're not a caseworker, let's say, you don't provide direct services, but you want to learn more about it, you can go through these courses as well. How to get a list of Chicago area SSI and SSDI lawyers. So I can't think, but I was thinking of maybe legal. So in Cook County and Chicago specifically, Legal Aid Chicago has a local SOAR lead. I can look up their information and send it to Candy Gler. I'll take a note of it. And most likely they might have information about SSI and SSDI lawyers to help. Sergio, just provide information about it. Thank you so much. We will be providing information on slides and training, all of this. How do you apply to become a SOAR manager? Um, by a SOAR manager, what do you mean by that, Tamara? If you can elaborate a little bit, sorry. If you mean like a local lead for the counties or just within your organization by itself? Or do you mean like to apply for your clients? Yes, local organization. Oh, okay. So which county is your organization part of, Tamara? Oh, Saline. Okay. I will reach out to you privately to talk about it because there might be an opportunity for you soon to become a local lead. Like I'll just provide the information about it because I don't think they have a local lead in Saline. Okay. Sorry about that. Just moving on. Um, Sorry, may I have this detail. Do SOAR have a pool of caseworkers who help with SSI and SDI? So There are a lot of caseworkers that are trained on SOAR. I do have like their info, for example, local leads in general and state leads have information about caseworkers that are trained within their area. However, because of SSI and SSDI applications normally take a long time. So normally for SSI applications without using the SOAR model can take up to over a year. While we're using the this specific model, this application has an average time of I think 177 days, which is much shorter. And yes, 177 days until you hear like of a decision, an approval or denial. So this is specifically for training. However, if you are trying to look for someone to help with SSI and SSDI applications, I would suggest again to go to the SOAR website and look up the SOAR local lead for your county and ask them if they have any if they know of any caseworkers that are accepting new clients for these to help them with the application. No, so SOAR training does not require homelessness, substance abuse, or mental health disability. It does not do a requirement, but the first thing was like the background of it, why it started. And one of the things that SOAR is aiming to do is end homelessness. Any more questions? And again, slides, information, extra resources will be sent in follow-up emails. Okay, let me just share. I'm just gonna stop sharing my screen here and share my browser. Just give me a second. One second. Let me reshare. So this is the website. Let me copy and paste it for you guys. So if you wanna go with me, you can go ahead. Sorry. Yes, you do need to create an account to access the training. However, you can look at the website without making an account, and making an account is completely free. So this is the SOAR website. Again, this is managed by SAMHSA, the Substance Abuse and Mental Health Service Administration. You can learn more about the model exactly, how it helps with SSI and SSDI, barriers to access, how to overcome these barriers, and there are a couple of videos just explaining about why SOARs are important, especially for adult providers and those who work with children as well. There's a state directory. These are all resources you don't have to log in for. You can look up for nationwide where you can find SOAR leaders, caseworkers, and so on. So Illinois, going to Illinois. Description of the project, it will give you how it's going on in Illinois, expectation to participate in SOAR within Illinois, and how to track outcomes and all of that. State events, if there's any events that are happening right now, you can see it over here. If there are any jobs posting for those who have SOAR trained here, documents, and success stories as well. Um, there's supposed to be, let's go to state directory and library and tools. There's supposed to be a way that you can see also state lead. Oh, so to see actually information about state leads and local leads, you will have to sign in. So every time you do sign in, they would send a code to your email, and you have to open your email, which is kind of annoying a little bit sometimes. And just put in the code they send you. It's a one-time security code. It's because of like the type of information that they do share here. And you can go in. I agree. Every time you have to agree. It will provide you information about user details, your title, which organization you're affiliated with, for example, um, location, city, state, and all of that, membership, when was the first time you joined, who is the TA Center liaison for you if you have any questions about SOAR, troubleshooting, issues with SSI DDS. The TA Center for Illinois is Abigail Kirkman that you can reach out to. She's very responsive as well. If you want to learn more about SOAR in your state, I'll provide these information again. Oh, here's the local leads. It might have been so information about local leads is going to be here and where exactly. So Lombard, Illinois, because I'm part of DuPage, we have a bunch of people in Chicago here. So if you're in Chicago and you want to learn about if they know of any caseworkers that are accepting new clients, you can reach out to them. However, a lot of people that go through the SOAR training are like caseworkers that want to help their clients. That's the situation currently in Illinois. One of the things I personally want to do in DuPage County is try to fix that and try to do like a better referral system. However, in Chicago itself, they actually have a very good referral system for SOAR, but I don't know if they're accepting any new applications, any new clients, sorry, for applications. We have people who are in Urbana, Illinois, people who are Bloomington, Illinois as local leads, and so on. Southern Illinois is a high need of this. hmm I think there is a local lead in Southern Illinois. Unfortunately, I'm not good with locations, but yeah, so if you do reach out to me tomorrow, I'll provide you more information about it. And I do know a couple of caseworkers that are in Southern Illinois that I can connect you with that they can talk to you more about about the SOAR and how it's going on with their clients and so on. So the online courses, after you do log in, you can start an adult curriculum or the child curriculum. You can sign into it, return to the course. You don't have to go through the whole thing at once. Library and tools. The good thing about library and tools, it provides you a lot of fact sheets, like a lot of fact sheets to help you, and they keep updating them. So our tools and worksheets, how to do child SSI applications, for example, SSA annual updates, any updates that are happening within Social Security Administration benefit, you will have them. So the federal benefit rate, all of this will be over here. Going back to library and tools. So many pages of resources. If we go to events, if there's any events that you can attend, these would be over here. So they do a lot of times like an overview of SOAR again for those who ever went through the training but want to go like to update or refresh some of the information, you can do that. Who to contact as well, which is the SAMHSA SOAR TA Center. So this is for everyone. For the localies, there's a separate thing that we do see as well, but this is in general for all of the caseworker. Any caseworker that makes an account and starts um the adult course or the child's course will have access to all of these information. And again, after you do finish this and you go through all of the homework, all of the quizzes and everything, you can receive a certificate of completion with 20 CEUs for that could help specifically for social workers. Are there any questions, or if there's something specific you want to look at this website, please let me know right now. Okay, so actually that was mostly the end of this presentation. I do have some resources at the end that you can open on your own on a separate slide from Social Security Administration website and from SOAR website and some fact sheets. All of that you would be receiving it through an email, hopefully after the training. Hopefully this was helpful for everyone. I know Social Security Administration benefits is kind of complicated. Um, yes, oh, thank you, everyone. Yeah. And hopefully this was very helpful for you. And let me know if you have any questions. You can reach out to me anytime. Thank you all.